HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. The history of Northwell's Staten Island University Hospital, Princess Bay, is rich in decades in healthcare. We continue to grow and expand with new technology and advancements. Join Dr. Ardolic and Meagan Sills to hear about the future of healthcare. Give it a listen.
Hey Staten Island, welcome to HealthWish. I'm here today with Meagan Sills, Vice President at Staten Island University Hospital. Welcome.
Thank you. Pleasure to be here.
And we've only done this once before and actually sat and talked about some of the amazing things that we're actually doing at the institution. And we've never done it with Princess Bay. You know, we both had the benefit of seeing the time capsule that was put in that showed us some things that were put in the archive in 1919. And it really was amazing. And, you know, you're sitting in a place now which is in the southern end of New York City, but is still a very populated place with a lot of people here. And we forget that in 1919, a woman whose husband had made a small to medium-sized fortune making bubblegum base decides that it's so important to her that there's health care on this side of the island that she opens a place. And this couple had the foresight to actually do this in 1919 and to actually start investing in it and stuck with it. And Bertha became a part of this place for really generations after her husband died and really was involved in the place for a substantial period of time. What was the most fun thing for you in actually getting to see that time capsule?
It's the history, right? You even see it now. People here at Princess Bay have been here for decades, dedicated to, taking care of this community. But to be there and see the history reflective of 1919, to see how far it's come is amazing.
Yeah, and then you fast forward and you think about it, right? So soon after that, a bunch of other places opened on Staten Island. All the way through the 70s, people decided they were going to open hospitals on Staten Island. And when the 80s dawned, there were 5 hospitals taking care of people here. And then quickly, the finances of healthcare changed. And can you imagine now today that actually being the case? Like, how would we manage it, given what we actually now know?
And especially back then. I will say this community has always come here for emergent care and the ER here, but it has come far since then.
And it's interesting how all of a sudden a decision is made that, if we're going to keep this place open for the next generation and we're going to actually invest in it, that we have to do something. And, we sat and had a lot of conversations about, all right, what do we do with a place like this and how do we actually make it a place that people will want to go to and how can you do something different? And then something that was a really terrible tragedy actually wound up helping us. Tell me how COVID helped change Princess Bay.
During COVID, we had to try to figure out how to continue to provide the care to the community, but not in an acute way. But, people with pain in the community that needed total joint replacements needed to go somewhere. And so how do you provide that care while still making the providers comfortable and the patients comfortable? So it was decided to leverage that as an opportunity to transition the total joint program for hip and knee replacements down to Princess Bay. And boy, did it take off, unlike we ever anticipated. Everyone here, and I think this is why we're so successful today, every provider, every employee, it allowed them to be part of something to the point where we had, about a month ago, a total joint replacement. We had shoulders, we had ankles, and hips and knees all in one day. We're actually getting some recognition now that some of these programs are really kind of meeting certain standards. Tell me about that. So after a few years of starting the program here, seeing how positive the results were and the volume was growing, we applied to the Joint Commission as a primary site for total joint replacement. And we made it. We received accreditation, but we didn't want to stop there. About a year after that, we prepared ourselves for advanced certification in total joint because when they were here for primary, the surveyor said, you're already at advanced status, so move forward. And we did, and we achieved that, and we continue to move in that direction.
So it's really incredible. So not only are you doing this in a community hospital, but you're doing it in a place where really was not thinking they were going to do anything like this just a few short years ago, and yet now is a place that is now recognized as an advanced joint replacement program by the Joint Commission. But now we've made substantive changes to this building. And this goes back a few years, and this started a little while ago, right? Started with working with ECHO and actually developing the new emergency department, adding some PED-specific beds, and really kind of changing the way we cared for people down there. But then The one that I think actually changes the most is to finally add an MRI to this place. Tell me about that.
So well before I came to Princess Bay back in 2018, there was a lot of conversation about not having an MRI as a primary site for care. Finally, we opened an MRI here so that the patients, inpatients, and outpatients can come here to get the imaging that they very much need.
That is one of the things that plays a huge role in us getting to where we want to with stroke care. So tell me kind of where we were and where we've been and kind of where we are right now in terms of taking care of people with strokes.
Since the MRI, the team has worked really hard to then balance getting the certification through the Joint Commission as a primary stroke center, which again just enhances the care that we provide in the community.
You can still go into the echo emergency department downstairs here and you'll get seen in under 10 minutes. So you have the opportunity to get taken care of in your own community in a judicious and fast way. And yet, as time goes on, we keep making these investments to continue to develop these programs as it actually goes. So one of the things that I think we realized fairly recently to specifically add some cardiac testing. Tell me about that.
So we've added a diagnostic outpatient facility, which also supplements the inpatient, but we have echo, stress. We also have inpatient EP here. There's an outpatient practice on site for cardiology, which also supports our office presence at 101 Tyrell.
I'm glad you brought that up. It goes hand in hand, right? So as you develop these institutions, you also have to develop outpatient and ambulatory, because at the end of the day, people don't realize that they actually have something going on with their heart on their own. There's been significant investment in Staten Island, specifically in the South Shore in the last few years. So tell me a little bit about 101 Tyrell.
So it's a fabulous building right off of the West Shore Expressway by the Outer Bridge. And it has anything from primary care to cardiology to pulmonary to pain management to orthopedics, podiatry, general surgery that really help provide the basic needs.
Yeah, and if you think about the fact that these are all services that really over the last couple of years have been introduced, right? There was nothing there just a few years ago. And to realize now that every time we open one of these offices, the need is so significant in the community that they're filling and requiring us to get additional space. I think we're on our 5th addition of space in 101 Tyrell because the need is so significantly there. And frankly, the community and the hospital are so on the same page that as we open up capacity, the community comes towards us and actually wants to be with us. It's actually wonderful.
And it pairs very well with the outpatient imaging footprint that we continue.
100%. You do a lot of urological procedures here, and yet we've chosen to put the urologist in one location on South Avenue, which it's not in the South Shore, but it's very South Shore accessible. So tell me about the Smith Institute of Urology.
So it's an exciting practice on South Avenue, high quality care and views, but it allows for the basic and comprehensive urologic care across the whole island and is just a drive away here if you needed a procedure.
The nice part is from one centralized location, it really gives us a tremendous advantage in that respect.
Yes. And the connection with the Farina Cancer Center.
Agreed. It's really amazing how you can go across the full spectrum of care and really keep people being taken care of in their own community.
Join us next time as we continue the conversation about the growth of the Princess Bay campus of Northwell Staten Island University Hospital. HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Meagan Sills. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.